So the last section of slides for the third exam includes balance. So we're going to talk about balance, static and dynamic, how to progress exercises related to improving balance, and what assessment tools are available for assessing balance. This is the definition of balance. It's a complex motor control task involving the detection and integration of sensory information to assess the position and motion of the body in space, and the execution of appropriate musculoskeletal responses to control the body position within the context of the environment and task. So the individual's balance is related to the position of the center of gravity and maintained over its base of support. This cone of stability is the normal amount of sway that occurs in an individual's body relative to the base of support, and that cone can vary depending upon the patient's position. But essentially what you need to know is that there is a normal amount of sway that occurs, about 12 degrees of sway, that can occur to maintain normal balance. So balance is looking in a couple of different positions. We look at it statically, dynamically, either in sitting and standing, and then there are automatic postural reactions that occur when external or extrinsic perturbations occur. So when we're looking at impaired balance, it can be a result of an injury or a condition that affects the structures that influence how our body processes balance and processes information that it receives from the environment. So the somatosensory input is information from your proprioceptors or kinesthesia, so where your body is in space, how your brain processes that information. Visual and vestibular, so those sensory systems provide us information relative to the environment and balance. So if we're looking at our vision and your head keeps your vision level with the horizon. So no matter what position your head is in, your eyes always try to stay level with the horizon. And when that doesn't happen, you can become dizzy. And then your vestibular system is the inner ear, and how the fluid moves around in the semicircular canals, that processes information on speed, where your head is in space. And this is one of the reasons why if you're trying to read while you're in a car, so you're trying to maintain your vision level on the surface that you're reading, but then the feedback with things speeding past you quickly, that contradiction in speed and stability is what can give you the feeling of motion sickness or nausea. So I am not a person that can read in a car because of that disconnect between those two symptoms and how I interpret that. It makes me feel dizzy. Then we have the sensory motor integration, which is just, again, more processing of information relative to the environment if you're on a stable or an unstable surface. And then motor output generation is that your body is creating the response that it is appropriate for the perturbation or the change in speed or surface necessary. So these are the different systems that affect balance. And if any one of these symptoms is impaired, it can result in impaired balance. So here's a slide that looks at the muscles that are important in coordinated balance movements. So this, if a person's coming in with impaired balance and they don't have strength or adequate strength in these muscles, that can influence whether or not they have good balance. So it's not just a matter of having them stand on an uneven surface or stand with their eyes closed, but they also need to have relatively decent strength in these muscles. So when we're looking at improving balance, we're also going to want to look at improving strength within these muscles that are important in maintaining balance. We're going to talk about the postural reactions that occur relative to perturbations or changes in environment. So these are the 5 postural reactions or strategies that occur, and we're going to talk about them specifically. So if you're standing, like you know an ankle strategy, like if you're standing on a bus or standing on the tram, like in between terminals and airports, and it makes a sudden stop or a sudden acceleration, you know that your ankles kind of kick in with that anterior posterior just to kind of keep your balance. So it minimizes that sway by activating the gastrocs. You have your weight shift strategy. So this is now looking at the side to side plane, and it's just shifting body weight from one leg to the other. So you may shift your weight when you're anticipating an acceleration or deceleration on that same tram. This suspension strategy happens when your center of gravity lowers when you bend your knees, and it causes also flexion at the ankles and hips. So this is just maintaining your center of gravity over in more of a lowered stance. The hip strategy is now a larger sway. So when your ankle strategy is not adequate to maintain your balance, you may have a larger sway that occurs now at the hips. The stepping strategy is now you've gone through the ankle and hip strategy, and the only way to maintain your center of gravity is to actually take a step either forward or backward in order to increase your base of support. Here are just some assessment tools, some different assessment tools. I also want to take a moment to show these assessment tools in PhysioU. So if you are in the PhysioU app, you see all the different tests, etc. What you want to do is go into neuro exam, and from there, you're going to have balance. That's going to show you the different just general balance grades. So if we're not using a specific assessment tool, we could just have an individual sit and then have them either support their balance in this position, and then we could challenge them by looking at how much time, or maybe give them some perturbations, like try and push them over. So we have these general balance grades, and then we have the actual assessment tools. So we're going to be looking at the functional reach, the Berg balance test, timed up and go. The book talks about the CTSIB. So there's Tonetti, Dynamic Gait Index. So there's just a lot of different assessment tools that quantify an individual's balance. What we're going to use next semester in neuro are the functional reach and the timed up and go. But I do want you to also be familiar with the Berg balance test, because we have used that with our patients in the campus rehab clinic. So when we're looking at the Berg balance, the higher the number, so it's rated on a scale of 0 to 4. 0 is the most significant impairment, and 4 is the highest functional level. So the higher the score, the less fall risk the patient has. And the lower the score, the greater the fall risk. So again, now we're back to this chart here, and it just goes over other balance assessment tools. You should also be familiar of what a Romberg is, and Romberg stance is when you're standing heel to toe. So your feet are actually in front of each other. So you can see how that would be a narrow base of support. So that's what a Romberg stance is. So how would we improve balance? We obviously need to know what system is causing the balance impairment. If it's something with the vestibular system or the visual system, then obviously that's going to require a different type of approach when trying to improve balance. But we need to know whether or not it's a strength issue, how the body's processing, how the brain processes input, either proprioception or kinesthesia. And then we want to look at those specific systems to focus our interventions on. Definitely want to look at the strength, going back to that slide with the specific muscle groups that are involved with balance. So you'd want to make sure that you had an assessment of those muscle groups. And then also we want to be aware of if the individual is taking any medications that could influence balance. So if they're taking anything for blood pressure or pain, that's going to slow down how the body processes information, which could impact how they respond to balance exercises. And then finally, how we could progress exercises are similar to what we would do for our closed chain exercises. So if we're doing standing activities, we would start with a wider base of support, gradually going narrow from a stable surface to a more unstable surface. So this could just be going from hardwood floors to now carpeting, and then going to an AirX pad. The base of support could go from a wide base of support, narrow, to single leg. You could take out the vision. So this would be the difference when you're looking at someone's balance with their eyes open versus eyes closed, how much sway they would have, and if they need to take a step to maintain their balance. So all of this is going to be indicative of how we would progress balance training. Want to make sure that when you're doing these types of exercises that you are being conscious of safety. So you're using a gait belt. You may start a patient in parallel bars or with their assistive device before changing the assistive device. So you might start, if they're using a walker, you could try taking one hand off the walker before you go right to a cane or crutches, or to be safe, you would do this inside the parallel bars. And then also you want it tied into function. If the patient or the individual doesn't have any carpet at home, then don't challenge them on carpet. But if they're going to go out to their daughter's house or grandchildren's homes that do have carpet, you would want to challenge them in that to make sure that they're safe or familiar with how that is going to feel to them, which would decrease the likelihood of falls. So we'll talk about other ways that we can progress balance exercises more when we get into our discussion groups for next week. But this last section of slides is it for the Exam 3 content. So you have your improving muscle performance slides, which there's quite a few of those, and then your balance slides, which that is all of the information for Exam 3.